Let's dive into the invisible force that powers literally everything you do, from thinking a thought to blinking your eyes. I'm talking about electrolytes. They're these silent, unsung heroes working behind the scenes in your body, and we're about to see just how critical their job really is. Seriously, just think about that for a second. What is it? What's the fundamental energy that lets your heart pump, your muscles move, and your brain fire off trillions of signals? Well, the answer isn't just about calories or oxygen. It's about something much more, well, electric. And there you have it, electrolytes. At their core, these are just essential minerals that, when they dissolve in your body's fluids, carry an electric charge. You can think of them as your body's very own electrical currency. They're what makes it possible for nerve signals to zip around and for muscles to contract. Without them, our internal wiring just wouldn't work. Okay, so who are the main characters in this whole electrical story? Let's meet the key players that keep your internal grid up and running. First up, we've got sodium. Now, we usually just hear about it in terms of salt, right? But inside your body, its main job is to be the master regulator of fluid balance. It basically controls how much water is inside and outside of your cells, which, as you can imagine, is fundamental to just about every single process in the body. And what's just wild is how incredibly precise the body has to be about this. Just look at these normal ranges. For sodium, you've got this tiny window of 135 to 145. For potassium, it's even more, just 3.5 to 5.0. And you can see the same insane precision for magnesium, chloride, bicarbonate, all of them. If you stray even a little bit outside of these ranges, it can cause really serious problems. It just goes to show you how carefully tuned your body's internal systems have to be 24/7. Okay, let's move on to potassium. So, if sodium is the fluid balancer, then you can think of potassium as the heart's rhythm keeper. It is absolutely essential for keeping your heartbeat steady and regular. But its job doesn't just stop with the heart. Potassium is also crucial for all muscle contractions. We're talking everything from blinking your eyes to lifting a heavy weight. And it's also needed to transmit signals all throughout your nervous system. It's a real multitasker. And next we have calcium. Now, most of us, when we hear calcium, we think of one thing, bones. And yeah, it's totally the body's structural engineer. About 99% of it is stored right there in our skeleton. But that tiny 1% left over, the little bit that's circulating in our blood, well, it plays some incredibly powerful roles. And this just shows you how amazingly versatile that 1% really is. I mean, besides bones and teeth, calcium is a key player in muscle contraction. It helps trigger the release of hormones. It's essential for your blood to clot properly, and it's involved in sending messages between your nerve cells. It is literally everywhere. So, these minerals are obviously super important, and their ranges are incredibly narrow. So how in the world does the body manage it all? Well, it performs this amazing, non-stop balancing act using some really sophisticated systems. One of the most elegant systems is called the bicarbonate buffer system, and it's what keeps the pH of your blood perfectly stable. The best way to think about this equation is like a chemical seesaw. If there's too much acid, those H+ ions on one side, the whole reaction just shifts to the left to make more carbon dioxide, which you then just breathe out. It's a totally brilliant way to keep everything in equilibrium. This quote really drives home just how precise this whole thing is. A 20-to-1 ratio. Not 19-to-1, not 21-to-1, 20-to-1. And to maintain this exact ratio, your lungs are regulating carbon dioxide while your kidneys are regulating bicarbonate. It's this beautifully coordinated dance between multiple organs, all happening without you even thinking about it. Now, what about calcium? Well, its regulation is this fascinating journey through multiple organs. It all starts in your skin with a little help from UV radiation. Then it gets processed in the liver. And finally, the kidneys perform the last critical step, creating something called calcitriol, which is the active form of vitamin D that actually lets us absorb calcium from our food. But what if your body needs to raise calcium levels, like right now? That's where parathyroid hormone, or PTH, comes in. When it senses that calcium is low, it acts like a master regulator. It tells your bones to release a little bit of their stored calcium, tells the kidneys to grab more of it before it leaves the body, and it boosts that final vitamin D activation step. It's basically the body's rapid response team for calcium balance. So what happens when these incredibly complex systems fail and that delicate balance is lost? Well, the consequences can be immediate and severe, affecting the very electrical systems that we all rely on to live. Let's take potassium, for example. If you have too little, a condition called hypokalemia, you can get things like muscle weakness or even dangerous heart arrhythmias. But if you have too much, hyperkalemia, that also causes muscle weakness and can lead to even more severe, life-threatening heart problems. The balance is truly everything. Now, this is where it gets really interesting. We can actually see the electrical impact of potassium on an ECG, which measures the heart's electrical activity. With high potassium, you see these classic peaked T waves. With low potassium, the T wave flattens out, and this new little wave, the U wave, can pop up. You are literally watching the body's electrical currency malfunction in real time. It's incredible. And calcium imbalance has this fascinatingly opposite effect on your cells. Too little calcium, hypocalcemia, makes your nerve and muscle cells hyperexcitable. That can lead to spasms and even seizures. But too much calcium, hypercalcemia, does the complete reverse. It dulls that excitability, which causes muscle weakness. And once again, you can see this reflected right there on the ECG, with changes to what's called the QT interval. So, when things do go wrong, how do doctors and nurses get the body back on track? Well, they rely on very clear, evidence-based protocols to restore that delicate balance safely and effectively. And this is pretty much what it looks like. It's not guesswork. This is an actual clinical guideline from the NHS for treating low potassium. It's a logical flowchart that guides a doctor's decisions based on a patient's specific lab results and their symptoms. The most important point here is that the severity of the problem dictates the solution. You can see on the guideline, if potassium is only a little bit low, a doctor might just use simple oral tablets. But if it drops into that severely low range, the risk to the heart is so high that IV replacement is necessary to bring the level up much faster and more reliably. And it's the same deal for other electrolytes, like magnesium. In fact, a lot of these guidelines recommend measuring electrolytes as a bundle, so checking potassium, magnesium, and calcium all together, because they're all so interconnected. You often find that correcting one actually requires you to support the others too. So what can you do to support your body's amazing balancing act? Well, a lot of it comes down to the fundamentals. Staying hydrated is obviously key, but it's also important not to overhydrate with just plain water because that can actually dilute your electrolytes. Eating a balanced diet full of things like bananas and spinach for potassium or nuts and seeds for magnesium gives your body the raw materials it needs. And especially after a really intense workout, remember you need to replenish not just the water you lost, but also those essential minerals you lost through sweat. When you step back and look at it, your body is just an astonishingly complex, self-regulating system. It really is a master chemist, working tirelessly every single second to maintain that perfect electrical balance that keeps you alive. So the real question is, knowing all this, how will you support its incredible work?